Hello and welcome to Alcohol: How Underage Drinking Affects Adolescent Development. When thinking of underage drinking, most people immediately think brain and liver, but as you will see over the course of this presentation, there are many other areas of developing teenagers that are affected by alcohol. Some questions to keep in mind are listed on the screen in front of you. How do our bodies cope with alcohol? What organs does alcohol affect? What are the short and long-term effects of underage drinking? It may be surprising to some that unlike other things we eat and drink, alcohol goes directly into our bloodstream and goes to our organs in the water found throughout our bodies. Organs that have a lot of water are affected more than those that do not contain water. An example of a water-heavy organ is the brain. Other organs affected include liver, heart, pancreas, and the kidneys. There are 4 systems in the body that are important to look at when discussing the effects of alcohol consumption, and those are the digestive, central nervous, circulatory, and endocrine systems. Let's take a look at them. This system, the digestive system, is made up of the mouth, esophagus, stomach, small intestine, large intestine, rectum, and anus. Like I mentioned earlier, alcohol is delivered directly into the bloodstream instead of going through the regular digestive process. This is because alcohol molecules are very small and do not need to be broken down by the digestive enzymes. Alcohol molecules easily dissolve in water and fat, which is essentially what our bodies are made up of. The stomach absorbs about 20% of the alcohol a person consumes, while the remaining 80% is taken by the small intestine. Included in the central nervous system is the brain and spinal cord. Because alcohol is a depressant, which means it slows down the central nervous system activity by enhancing the effects of the neurotransmitter GABA. Some impairments that accompany a depressed CNS are slurred speech, unsteady movement, perception issues, and the inability to react quickly. Alcohol also reduces a person's ability to think rationally and distorts judgment. The rate or degree of slowing down the CNS is dependent on how much and how fast a person consumes alcohol. Included in the circulatory system is the heart, veins, arteries, capillaries, and blood. For adults, studies show that a glass of alcohol daily may increase heart function. The key words here are adults and may. According to the American Heart Association, that study is up for debate. However, large amounts of alcohol affects how the heart functions. Dangers include high blood pressure, obesity, stroke, breast cancer, suicide, and accidents. Especially in teenagers, the risk of alcoholism and dependency on alcohol is very prevalent. If the heart isn't pumping blood correctly through the body, other organs may suffer from a lack of oxygen or nutrients. The endocrine system is one of the most important for that of a developing teen because it helps regulate growth, tells the body when to start puberty, regulates metabolism, tissue function, and sends chemicals in the form of hormones from glands in the brain which determine one's mood. The endocrine system regulates communication between organs in the body which maintain homeostasis. This system is also responsible for reproduction and plays an important role in helping the body respond to internal as well as external factors, like change in body temperature. The abuse of alcohol is seen to have serious effects on this system, including hormonal imbalance, which can lead to disorders such as cardiovascular disease, reproductive deficits, immune dysfunction, cancers, bone disease, and physiological and behavioral disorders. Alcohol also impairs the function of the glands in your brain that release hormones and tissues where they are being sent. Some of the short-term effects of drinking. In moderation, drinking can reduce stress and tension. It can enhance your mood, increase relaxation. It can have it can help reduce anxiety for social situations. It also can increase pleasure and improve social cohesion. However, if you drink too much, it can lead to slurred speech, drowsiness, confusion, poor coordination, dizziness, vomiting, and blurred vision. The long-term effects of underage drinking are, in moderation, you can have a longer life, reduced risk of heart disease and heart attack, increased ability to survive a heart attack, reduced risk of stroke, gallstones, kidney stones, diabetes, rheumatoid arthritis, metabolic syndrome, and dementia, including diseases like Alzheimer's. Like I mentioned earlier, these studies are up for debate in the American Heart Association, so just a side note on that. However, drinking too much over a long period of time, for example, years, can lead to liver damage, stomach ulcers, and irritation to the pancreas. Kidneys will stop maintaining the correct amount of fluids and minerals in your body. You can start having headaches and loss of body heat as a result of your veins getting bigger and widening. Your body stops producing red blood cells, which can result in anemia and infections. Your muscles can weaken, which includes your heart, because it's the biggest muscle in the body. Thank you. And here is my bibliography if you want to take a look at that.